Hi, I'm Dr. Tracy Pfeifer, a double board certified aesthetic plastic surgeon in New York City. Today we're going to talk about mommy makeover. For all you mommies out there, you love your children, but did anybody warn you what was going to happen after you had your baby? Maybe not. But there are some easy solutions that can restore your figure and give you the self-confidence and happiness that you want to have after you've had children. So let's first talk about the breast. When you have a pregnancy, whether or not you've breastfed, the breast obviously changes a little bit. There's milk that gets produced, there's swelling of the breast, this can stretch the skin, and after all of the milk goes away, there has been a compression of your breast tissue, and many women experience a loss of volume or fullness in the upper half of the breast. So patients come in and they say, I'm still in the same cup size bra, maybe I'm in a C cup bra, but it's gapping at the top. I'm not filling it the way I used to. So in that social area of the breast, the cleavage area, you notice that there's a loss of volume. The solution for this is to have an implant. You can have a small implant. It doesn't have to be a large implant. The key to having natural results breast augmentation is to have an experienced board-certified plastic surgeon who understands how to measure and pick the right implant for a given patient who has a particular goal in mind. There are hundreds, if not thousands, of implants, so you can't just put the same implant in every patient. You have to be an artist and really be able to customize the result for every patient. So in order to restore that volume, an implant is going to help us out a lot. Some women also experience a stretching of the breast skin. So there's too much breast skin and the breast is sagging. These people benefit from having a lift. A lift is done by removing some of the excess skin, just like a tailor would. You're basically making a pattern on the breast and saying, this is how much skin the breast should have to give it the lift and shape that we want it to have. So this extra skin needs to be removed, and the nipple usually is sitting too low, so the nipple is elevated from a low position to a higher position and the incisions are closed. This can be done with or without an implant. Now when we talk about a breast lift, there are three types of incision patterns that a person could have. We could have a periareolar incision, where the incision is just at the edge of the areolar border. You could have a lollipop pattern where it's around the areola and then down. The vertical part is the stick part of the lollipop pattern. Or you could have an anchor pattern, which is very rarely used, but that would involve periareolar, vertical, and then in the crease. How much skin needs to be removed and how low the nipple is, and therefore how much it needs to be elevated, determines the incision pattern. So if the nipple needs to be moved a centimeter, you're only going to need a periareolar incision. If it's about 2 centimeters or a little bit more, you're going to need a lollipop. When people look at incisions, they sometimes are a little bit reluctant to say that they would like to have that done. They just want an implant. But keep in mind that all these incisions heal very well. It's going to fade to a thin white line that is narrow. If you wanted to, you could have a little tattoo so you don't even see the white color of it after it's healed. Very few patients actually select that option, but you could do that. And keep in mind that the vertical part of the lollipop incision is going to catch your eye the most in the beginning as it's healing. The one around the areola you don't really see that much because it's a circle around a circle. But the vertical line you're going to notice more because your brain is going to say, hey, what is that line doing there? But as it fades out to white, eventually you're not going to see it. So just keep in mind, in the initial postoperative period, don't focus on that incision so much because the way it looks at week 6 is not the way it's going to look at 6 months. It's going to fade and your eye is not going to detect it anymore. Because some patients want to avoid having an incision on the breast, and I totally understand that, they will select an implant which is actually too large for them because the implant, if it's large enough, will take up that extra skin envelope. So instead of having an incision to remove the extra skin, they use an overly large implant to take up the extra skin. This is a no-no. You will not be happy with the size. You will be back in the office in 6 months saying that this is not the right size for me. I feel self-conscious. I feel like I'm out of proportion. So keep in mind that selecting the proper size implant is the most important thing that you can do. Don't select an oversized implant as a substitute for removing extra skin. That's not in your long-term best interest. Now, let's talk about the second part of a mommy makeover. That involves a tummy tuck or a mini tummy tuck. After you've had a baby, there are several things that happen to your body in the abdominal area. There are two muscles, the rectus muscles, which attach to your ribs and they insert down on the pubic bone. Those are the six-pack muscles. Those are the sit-up muscles. Those muscles, even though there are two of them, they're touching in the center. And after pregnancy, they can become separated and pushed off to the side. We call that a diastasis, but the word is not important. The important thing is that since there's a separation, those muscles need to come back together. Otherwise, even after the excess skin is removed, you could have a slightly rounded contour to the abdomen. So during a tummy tuck surgery, those muscles are relocated and sewn together in the center. And then the extra skin, that sort of apron flap that's flopping over your pants, or when you sit down you notice it, that extra skin is removed so that your abdominal contour is flat and you don't have this redundant skin that's folding on top of itself. In order to do that, you need an incision in the bikini line, just where you would have a C-section scar, but it goes a little bit longer out towards the hip bones. And then usually you have a little incision also around the belly button. In some cases, we're able to do a mini tummy tuck where you have an incision in the bikini line, but nothing around the belly button. For a few people, we can do something called an umbilical float. In an umbilical float, the belly button is released from its attachment to the muscles and it's reattached to the abdominal wall in a slightly lower position. So that way, if there's a little bit of extra skin above the belly button, it gets smoothed out. Most people have a significant amount of laxity of the skin above the belly button, so we do a traditional tummy tuck where the skin between the belly button and the bikini incision is all removed. Then the upper skin is pulled taut and brought down to the bikini line and sutured in place. That really smooths out and stretches out all of that extra redundant skin of the abdomen, including above the belly button. The recovery after a tummy tuck is very straightforward, but you have to remember no heavy lifting or exercising for 6 weeks. So I tell all of my tummy tuck patients, tummy tuck is a straightforward operation. You're going to be very happy with the result. The most important thing is figuring out when is the time of year that it's best for you to do the procedure so that you can have enough help at home with the children and activities around the house. So tummy tuck, timing is the most important thing. When is the best time of year for you to have it? So I hope that gives you a little bit of information about Mommy Makeover. Please visit our website for additional information. I look forward to seeing you soon.